Yes, this has always been the case that at least 2 evidence types are required for each competency. The evidence types documented on the framework is the compulsory evidence type. So this evidence type will always be used, and then your assessor will use an additional evidence type to complete assessment of an individual competency. I would encourage everybody to refer to the college website where full details of the OSCEs will be given, but in a nutshell, the OSCEs are still taking place. There will be 16 stations as before, including 2 pilot stations, and OSCEs are planned to take place in January. The cut-off for that is the 18th of December, and some more OSCEs are planned for March. That is an area which has seen quite a change from previous years. There is no longer a minimum number of RGP fits to be done on real patients. This competency can now be achieved by using a witness testimony and working with your supervisor. And for an RGP aftercare, all trainees are expected to see 1 RGP aftercare during stage 1. It's very important that while you're carrying out dispensing patient encounters, that you work with the patient to understand what their requirements are in terms of dispensing. And all these notes should be recorded on the patient record. You may, when you speak to somebody who's been in the practice for a long time or somebody who did their pre-registration several years ago, hear the mention of templates, dispensing templates. All dispensing templates and all templates of any type have been removed and are not accepted as part of the scheme for a registration assessment process.
We have always given numbers as a suggested amount for each visit to give you some guidance about whether you're ready for the visit or not. And yes, there's a minimum suggested number of patient encounters for visit 1 of 30 overall, with 10 for refraction, 10 for dispensing and 3 for contact lenses, and more to make up the 30. Remember, that's a guidance. If you've got 27 and you feel ready, that's fine, and it gives you an idea. If you've only got 2, then maybe it's best to hold off and get some more before you do the visit. So it's to give you some feel for whether you're ready. You've had the reflection portfolio material since the end of November. Reflection is most usefully done fairly soon after the event of seeing a patient, so it's going to be most useful to you to use that portfolio for patients that you've seen recently. You can certainly do it for patients that you've seen in September and October, but it'll be more meaningful to start it with patients you've seen recently.
It's really important to stress that the scheme for registration is a marathon. It's certainly not a sprint. You need to demonstrate to your assessors at stage 1, stage 2, that you have the knowledge required for each competency, and that you've had the experience of the different types of patients, and that you've you can evidence all the different patient encounters. You need to have completed the hospital experience, and also the OSCEs only run 4 times a year. Having said that, I am aware of a very small minority of trainees who have completed the scheme for registration in 9 months. Recently, the typical time spent in the scheme for registration is 15 months. And as is mentioned on the college website, you actually have 2 years, 3 months to complete the scheme.
In the new logbook, there are 4 categories of patient encounters. One is refraction, one is dispensing, one is contact lenses, and one is other. It'll be useful for you to look at the handbook on the website to explore what the definition of other is. But part of the definition is that it is a standalone appointment which would involve some kind of management decision. If you are dilating a patient and seeing them on a different day, but that's part of your eye exam, that would count as part of your eye exam and wouldn't be other. And so that it comes down to who's made the decision about those drops, why they've been put in, what you're then doing afterwards as to whether that counts as other. So it's difficult to answer your question without knowing the details of what your circumstances are, but please have a look at the website for more information.
In an ideal world, all of you would secure a hospital placement during your pre-registration year. Unfortunately, due to the impact of the pandemic, this is unlikely to be achievable. If you can secure a hospital placement, then please do so working with your supervisor and your local ophthalmology unit. But for the 2021 cohort, you are eligible to complete the virtual HES module, which is comprised of 9 components, including the interactive low vision component, which you have to register for. And once these different components are completed, then you show your certificates to your to your assessor. The hospital experience does have to be completed within stage 1.
All your mandatory encounters that you need to get throughout stage 1 are listed on the logbook, and the reason we've done that is to help you think ahead. Patients might not come in the order that you need them for your visits, so it's really useful if you're thinking ahead and looking out for patients that might be slightly harder for you to come across. In the example of an incomitant deviation, pay attention to your patients who come in and look out for a head turn or a head tilt, and be thinking about their doing motility on those patients. You may want to do motility on everyone. Remember that the incompetency doesn't need to be acquired, it can be congenital, and over the next 6-8 months you will see someone with an incompetency if you look for it. Good luck. In stage 1, you have a number of work-based assessment visits. You may just have one, and you'll have a number of remote visits. There are 75 competencies, and you need to prepare for each of those. Use the competency wording and the indicators to prepare. Some of the competencies have mandatory evidence, and that might be, for example, APR, anonymised patient record. If that's a mandatory evidence, you need to get a record ready, you need to anonymise it, and your supervisor needs to complete the declaration that you've anonymised it appropriately. Remember that getting that record ready is part of your preparation for the competency. Don't just do that, look at all the indicators as well so that you know that you're going to be ready.
Yes, you only require one record for each patient encounter. The thing to remember is, though, that during your pre-registration year, you will develop, you'll you'll gain greater knowledge and greater expertise. So if you see a patient, maybe with a red eye, and you think, oh good, I've got that patient, don't sit back on your laurels, because you may find that further down the year you see another patient with a red eye, and that's actually a better example. So I would advise you always to use the most up-to-date example of a patient encounter for your assessor. A second question came in: can you have two anonymised patient records ready for a specific patient encounter? Yes, but always present your best record first for your assessor. Assessment time is always quite tight for each of the visits, so you need to be as prepared as possible and have your best evidence available when your assessment visits are taking place.
For competency 421, you need a patient record of a patient who needs some kind of low vision aid. It's good that you're thinking about this at the early stage in the stage 1 process. Remember that you will probably see some older patients, and it's quite likely at some point that you'll have a patient who can perhaps only read N8 or N10, and just something very simple like a +5 hand magnifier would be really useful for them. So remember to think about that. When you're seeing a patient who's got a little bit of dry macular degeneration, also think about their visual function and would a low vision aid be helpful.
So the supervisor review score is on all the visit framework documents, and also on the reflective portfolio tab in your logbook. You should sit down with your supervisor once a month and go through the competencies with them, and your supervisor will give you a score, 1, 2 or 3, on how they feel your experience has been for each competency. This will also give you an opportunity to talk to your supervisor about any concerns you might have about the competency. The most up-to-date supervisor review score is then added onto the framework document before you send this on to your assessor, at least 1 week before your visit date.